This station is designed to test your ability to control hemorrhage. This is a scenario-based testing station. As you progress through the scenario, you will be given various signs and symptoms appropriate for the patient's condition. You will be required to manage the patient based on these signs and symptoms. The scenario will be read aloud to you, and you will be given an opportunity to ask clarifying questions about the scenario. However, you will not receive answers to any questions about the actual steps of the procedures to be performed. You may use any of the supplies and equipment available in this room. You have 10 minutes to complete the skill station. Do you have any questions?
I do not.
You respond to a stabbing and find a 25-year-old female victim. Upon examination, you find a 2-inch stab wound to the inside of the left arm in the elbow crease. Bright red blood is spurting from the wound. The scene is safe and the patient is responsive and alert. Her airway is open and she is breathing adequately. Do you have any questions?
I do not.
You may begin.
All right, BSI, is my scene safe?
Your scene is safe.
I'm going to start by holding direct pressure on the wound.
The wound continues to heavily bleed.
Okay, I'm going to ask my patient to hold direct pressure while I prepare my tourniquet. Going to go high and tight above the joint. Or 2 to 3 inches above if we can visualize the wound. Gonna turn my windlass rod until the bleeding stops. Go ahead and secure that. Going back to hold direct pressure.
The patient is now showing signs and symptoms indicative of hypoperfusion.
Okay, so I'm going to properly position my patient according to local protocol. Going to administer high flow oxygen via non-rebreather at 15 liters a minute. Going to put a blanket on my patient to prevent heat loss. And then we're going to prepare to immediately transport. And then that concludes my scenario.